JJ and Emma Chun.
JJ Emma Chun.
JJ and Emma Chun.
Health class walls.
JJ and Emma Chun.
Sequence of bases and DNA codes with a sequence of amino acid codes.
JJ and Emma Chun. We did it! Okay.
Today we're going to talk about the world's second most deadly killer. Tuberculosis! Tuberculosis! Tuberculosis!
Tuberculosis, or TB, is a disease affecting the lungs caused by an airborne bacterium, Mycobacterium tuberculosis, which is communicable and is spread when a person with active tuberculosis coughs or sneezes. Although it's not easy to contract, you're more likely to get a TB from someone you live, work, or go to school with, rather than with a stranger. The best way to avoid contracting tuberculosis is to be careful if you know someone has it.
There are two types of tuberculosis, latent and active. Latent TB is when the bacteria is in the body but there are no visual symptoms and it is not contagious. It is estimated that a third of the entire world's population has latent tuberculosis, and it can become active tuberculosis. Active TB is when the bacteria does cause symptoms and can be spread. So what exactly are these symptoms? Dr. Johnson?
Well, Emma, latent tuberculosis causes coughing, sometimes with mucus or pain. It is also associated with fever, chills, fatigue, weight loss, appetite loss, and night sweats. If the infection is not treated, it can spread from the lungs to other parts of the body, such as your bones, your brain, your heart, your liver, kidney, and probably some other stuff. I'm not going to mention that. Okay, this can lead to joint pain, meningitis, and if it goes without being treated, death.
Fortunately, if TB is detected early on, it most likely can be cured. Doctors check for tuberculosis with a skin diagnosis test. First, they inject an extract of the bacteria. After a couple days, if a red bump pops up, the patient most likely has TB. They can then be administered antibiotics for around 6 months. These antibiotics sometimes adversely affect the liver, but they will kill the bacteria.
There are also vaccinations for tuberculosis that are required in some countries. However, in the U.S., doctors recommend that you don't get the vaccinations because it can influence the results of skin diagnosis tests.
Tuberculosis is most prevalent in Africa, Afghanistan, Southeast Asia, China, Russia, South America, and the Western Pacific region. The World Health Organization estimates that 9 million people die every year of this disease, mostly in countries where medication is not accessible or the bacterium has become resistant. Fortunately, TB rates have been decreasing steadily since 2000.
Thanks for watching!
Fortunately, if TB bacteria is
Hold up!
That's not right.
It's Lauren and Jaden, and today we are talking about Parkinson's disease!
JJ and Emma Chun.